Uncovering the root causes of thyroid disorder, Dr. David Brownstein. Are you tired of feeling fatigued, gaining weight, or struggling with depression, but not getting any answers from your doctor? What if the root cause of these symptoms is an undiagnosed thyroid disorder? In today's video, we'll be uncovering the root causes of thyroid disorders and how often they go undiagnosed, leading to unnecessary treatments. Dr. David Brownstein is a family physician with years of experience in both conventional and alternative medicine. He's dedicated his career to helping patients understand the deeper physiological causes of their symptoms. Dr. Brownstein believes that many of the health issues we face, from fatigue to depression, could be traced back to an imbalance in the thyroid gland. Join us as we dive into Dr. Brownstein's insights on how thyroid dysfunction might be affecting your health, and how a holistic approach could lead to real solutions. Let's get started. Let's dive deeper into the critical role of the thyroid gland.
The thyroid gland sits in the lower part of our neck, and it weighs about 1.5 ounces. It produces about a teaspoon of thyroid hormone for a whole year, and that teaspoon of thyroid hormone has to drive the metabolic rate of every one of our trillions of cells 24 hours a day, 7 days a week. And little variations in that teaspoon of production of thyroid hormone have big effects on the body.
The thyroid gland, although small, plays a huge role in the body's overall functioning. Sitting at the lower part of the neck and weighing only about 1.5 ounces, it might seem insignificant in size, yet its impact is enormous. This small gland produces approximately a teaspoon of thyroid hormone over the course of a year, a quantity that might appear negligible. However, this tiny amount drives the metabolic activity of every single one of the trillions of cells in the human body. Dr. Brownstein emphasizes that the thyroid's function is not just vital, but constant. It works tirelessly, 24 hours a day, 7 days a week, to regulate the body's metabolic rate. From converting food into energy to supporting cellular repair and growth, the thyroid hormone ensures that all these processes occur smoothly and efficiently. Even minor changes in the production of thyroid hormones can significantly affect the body. When the hormone levels dip or rise, it can disrupt the balance of metabolic activities, leading to noticeable symptoms. Fatigue, weight fluctuations, and changes in mood or energy levels are just a few examples of how sensitive the body is to thyroid hormone variations. Dr. Brownstein's explanation highlights why thyroid health should never be underestimated. A well-functioning thyroid is crucial for maintaining balance, energy, and overall health, making it an essential focus in both conventional and holistic medicine. Now let's explore the frequent misdiagnosis of thyroid disorders as depression.
Antidepressant medications have their place, but I think that they're just way overused, and I think before putting someone on antidepressant medication, patients deserve a complete physical and history and a complete endocrine workup to rule out other causes, underlying causes such as hypothyroidism.
Fatigue and depression are among the most common complaints brought to medical professionals, whether they are family physicians or mental health practitioners. These symptoms lead many patients to seek help. However, as Dr. Brownstein points out, these issues are not always rooted in mental health. Instead, they can sometimes be caused by an undiagnosed thyroid disorder. The misdiagnosis occurs because the symptoms of thyroid dysfunction and depression overlap significantly. Fatigue, low energy, and feelings of hopelessness or sadness can be indicators of either condition. For many patients, the standard response is the prescription of antidepressant medications. While these medications can be helpful for true cases of depression, Dr. Brownstein argues they are often overused, especially without a proper investigation of potential underlying causes. He stresses the importance of a comprehensive approach before jumping to conclusions. This includes a thorough physical examination and a detailed endocrine workup to rule out thyroid issues. Evaluating thyroid function involves more than just routine blood tests. It requires assessing symptoms and other indicators to get a full picture of the thyroid's health. Message is clear. Practitioners must look beyond surface-level symptoms. By identifying and addressing thyroid problems early, patients can avoid unnecessary treatments and find relief for their true underlying condition, improving their overall well-being. Surprisingly, thyroid problems might be more widespread than we think. Let's take a closer look at the signs.
If my numbers are correct, and about 40 to 50% of the population has an undiagnosed abnormal thyroid problem, that would explain this explosion of anxiety, depression, fatigue, brain fog, apathy, symptoms that we're seeing in all these patients, versus all of a sudden it's just crept upon us that, half the population is depressed and anxious and fatigued, which I don't necessarily think is the case. I think they have underlying physiologic problems that need to be rebalanced.
Symptoms such as fatigue, weight gain, brain fog, anxiety, and apathy are commonly associated with stress, lifestyle problems, or mental health conditions. However, Dr. Brownstein highlights that these symptoms may also point to thyroid dysfunction, particularly hypothyroidism. This overlap can make it challenging to correctly diagnose the root cause of a patient's discomfort. The problem lies in how easily these signs are dismissed as being psychological rather than physiological. Fatigue might be attributed to overwork, brain fog to aging, and weight gain to poor diet. Anxiety and apathy, often misunderstood, can also be mistakenly labeled as emotional or mental health issues. Unfortunately, this can lead to improper treatments, such as antidepressants, which do not address the thyroid problem at its source. Dr. Brownstein reveals an eye-opening statistic. Up to 40 to 50% of people may have undiagnosed thyroid problems. This staggering number suggests that a significant portion of the population may be struggling with symptoms that could be managed or even resolved through proper thyroid treatment. While not every patient with these symptoms has a thyroid issue, it is crucial for healthcare providers to consider it as a possibility. A careful evaluation of thyroid health, alongside other diagnostic methods, can lead to more accurate diagnoses and effective treatments, ultimately improving patients' quality of life. The personal story that led Dr. Brownstein to embrace holistic medicine.
My father was suffering from severe heart disease. He had his first heart attack at age 40. He had a second heart attack shortly thereafter. He had angioplasties and bypass surgeries and type 2 diabetes, and my father smoked and was overweight and didn't eat good and never exercised, never really took care of himself. And as I started practicing conventional medicine, he was pretty much dying at that point.
Dr. Brownstein's journey into holistic medicine began with his father, Ellis, who faced severe health challenges. Ellis suffered from heart disease, experiencing his first heart attack at just 41 years old. Over the years, he underwent multiple medical interventions, including angioplasty and bypass surgeries. He also struggled with type 2 diabetes, was overweight, and lived an unhealthy lifestyle. Watching his father's health deteriorate deeply affected Dr. Brownstein, especially as he pursued a career in conventional medicine. Feeling dissatisfied with the limitations of traditional treatments, he began exploring alternatives. A patient introduced him to the book Healing with Nutrition by Dr. Jonathan Wright. This book highlighted the connection between thyroid dysfunction and cardiovascular disease, sparking Dr. Brownstein's curiosity.
The underlying cause of many cardiovascular patients was thyroid problems. So I read his chapter. I called my dad in the office the next day and drew some blood work on him. I had my dad do his basal body temperatures. Now, my dad's blood work came back in the normal range, but on the lower side of the normal range. My dad had very low basal body temperatures, almost undetectable with a basal thermometer. He met many symptoms of low thyroid. He was tired, he was depressed, he was cold all the time, he had dry skin, he was constipated, he had problems with his weight, his hair was falling out, his nails were cracking, a host of signs to meet the diagnosis.
After learning about the link between thyroid problems and heart health, Dr. Brownstein decided to check his father Ellis's thyroid function. Even though Ellis's blood test results were considered normal, Dr. Brownstein didn't think this was the full picture. He knew that thyroid issues could sometimes be missed with standard tests, so he looked beyond the lab results. One of the key things Dr. Brownstein noticed was his father's basal body temperature, which was very low. A low temperature can be a sign of low thyroid activity, also known as hypothyroidism. In addition to this, Ellis had many classic symptoms of hypothyroidism, like constant tiredness, dry skin, weight gain, thinning hair, and brittle nails. These symptoms are common when the thyroid isn't functioning properly. But they had gone unnoticed for years. Dr. Brownstein realized that even though Ellis's blood work was within the normal range, his body was showing clear signs of thyroid problems. This case showed him how important it is to look at the whole picture, including symptoms and other indicators, instead of relying solely on lab results when diagnosing thyroid disorders. Let's now dive into Dr. Brownstein's broader approach to medicine, which combines both conventional and alternative therapies. Dr. Brownstein's perspective on medicine evolved dramatically after witnessing the limitations of traditional treatments, especially in his father's case. He realized that the typical model, which often focuses on prescribing medication to manage symptoms, doesn't always address the root causes of health problems. This realization led him to embrace a more holistic approach, one that blends the strengths of conventional medicine with the benefits of alternative therapies. Instead of simply relying on medications to treat symptoms, Dr. Brownstein emphasizes the importance of identifying the underlying physiological issues that may be causing these symptoms. The shift in focus has led to more effective, long-term solutions for his patients. By identifying and addressing such physiological causes, Dr. Brownstein aims to provide a more comprehensive treatment plan that includes lifestyle adjustments, nutritional support, and hormone therapy, rather than just pharmaceuticals. This integrative approach was the foundation of his practice and philosophy, shaping the way he approached patient care. His belief that the body's systems are interrelated and that one imbalance can lead to a cascade of other issues drove him to look beyond traditional treatments. In fact, his holistic method has not only improved his father's health, but has also shaped how Dr. Brownstein works with all his patients. By focusing on the whole person, body, mind, and lifestyle, Dr. Brownstein's approach empowers patients to take control of their health in a way that is sustainable. His method doesn't just aim to eliminate symptoms, it seeks to restore balance to the body's systems, optimizing health from the inside out. This holistic approach has led to better patient outcomes and a more rewarding career for Dr. Brownstein as he continues to challenge the traditional medical model. How thyroid hormone therapy can transform health when thyroid imbalances are addressed.
I elected to put my dad on a small course of thyroid hormone, and literally within a week of doing that, his 25-year history of angina melted away.
In cases of thyroid dysfunction, traditional blood tests may show results within the normal range, but that doesn't always reflect the full picture of a patient's health. Symptoms like fatigue, weight gain, and other signs of low thyroid function often go unnoticed, even when blood tests don't flag a major issue. However, when thyroid imbalances are identified and treated with the right hormone therapy, significant improvements can occur. For example, when thyroid hormone therapy is administered, patients often see rapid improvements in their symptoms. For many, conditions that have persisted for years, such as chronic fatigue or even cardiovascular issues like angina, can dramatically improve within just a few weeks of treatment. These remarkable recoveries highlight the importance of addressing thyroid imbalances and considering more than just standard lab results. This approach emphasizes the need for a more individualized and comprehensive method of care. Rather than relying solely on routine tests, doctors should consider a patient's symptoms, history, and overall health to provide more accurate diagnoses and effective treatments. Thyroid hormone therapy can offer a transformative solution, helping many people regain their vitality and quality of life. Thank you for watching. We hope this video helped shed some light on the often overlooked connection between thyroid dysfunction and symptoms like fatigue, weight gain, and depression. As Dr. Brownstein shared, addressing the root causes through a holistic approach can make all the difference in your health journey. If you found this information helpful, don't forget to like, subscribe, and share it with anyone who might benefit. And if you have any questions or thoughts, feel free to leave a comment below. Take care of your health, and remember, sometimes the answers lie in the most unexpected places. See you in the next video.